All right, and you go right ahead and go to the topic of what's going on there.
Okay. All right. Sounds good. Well, good afternoon, listeners. You're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All right. So today we're going to do part one of a two-part series. And what we're going to talk and what we're the topic is the silent killers. Why blood pressure and diabetes still catch people off guard. And yet again, we've been doing this for a couple of years. We've been talking to the people, but yet again, and like I said, they got this, they got health fairs, we got all these things going on, and nonetheless, chronic diseases continue to increase, right? They continue to increase. Hypertension, diabetes, these numbers keep going up. People are still suffering from what we call these chronic diseases. And one of the things you might be asking is like, what's going on? Why is this stuff still catching people off guard? Why is it still sneaking up on folks? And today we're going to talk a little bit about why these diseases continue to plague, really in America, it's kind of all over, but like, of course, for us, it plagues us so differently. And and really kind of, um, causes us to have like worse outcomes. So like even though there's a lot of folks that are getting it, in the African American community, it just seems to be worse. Hypertension, I think we have the highest hypertension rates in the world, in the entire world, African Americans, okay? So the question becomes like, why is this happening? Why is this affecting our community so much? And I, kind of looked into some things. And so a lot of this stuff, of course, is from kind of my experience as working as a physician. And of course, we always have to give you the disclaimer that I'm a physician, but I'm not your physician. So we always give a disclaimer that this is for education and entertainment pleasure purposes only. And so you always want to get your health advice, your specific health advice from your health care clinician. So whether that's a physician, nurse practitioner, or physician assistant, you want to get that information from them. But this information right here is designed to kind of help you with those interactions and also nudge you to get one if you don't have one. That's the other part. So yeah, so that's it. And so why do we call these silent killers? And you'll hear that a lot, whether it's here or other places, they'll call these things silent killers. And the reason why they call these conditions silent killers is because, they tend to not really cause symptoms, especially hypertension. Um, you know, they just kind of, it's kind of there. And like I said, some people that get high blood pressure will get like headaches and stuff of nature, but that's usually like really severe cases of high blood pressure. And technically speaking, you definitely that's really an emergent condition when you get headaches or blurred vision. That's really emergent. But before that, I mean, a lot of people will just have these conditions. It's just kind of sitting there. Diabetes, especially type 2 diabetes, you can have that for a while and not really either not notice the symptoms or the symptoms are really kind of mild and they're kind of ignored. And so they creep up slowly on you. And a lot of time, by the time you notice something wrong, it's because, some real damage has been done. Like I said, high blood pressure is, yeah, again, I keep harping on high blood pressure, part because it's what I do, but the other part is because that one really, with diabetes, you might get some other symptoms, fatigue, or like I said, maybe you're peeing a little bit more than others. High blood pressure can really be that ninja. Okay, you don't know nothing until something is until something is really broken because it can be there, and like I said, you get these end organ damages where it's a stroke, heart failure, kidney failure, those sort of things that are happening to you with high blood pressure. So that one is that's the real deal right there. Okay. So today we're going to talk a little bit about, why these conditions are often missed, ignored. We're really going to talk about us. We're going to talk about the African Americans and some of the reasons why, we seem to be disproportionately affected by this. And then a topic that I think a lot of people just don't touch on, and that's health literacy and why how that plays a role as well. Okay. So, in terms of the big picture with this, according to Centers of Disease Control and Prevention, like nearly 1 in 2 adults has in the United States has high blood pressure. Okay. And only about 1 in 4. Okay. So like half the country has it. So half the country meets the criteria for high blood pressure. Only 25%, so 1 in 4. So this is the people that have the high blood pressure. Only 1 in 4 has it under good control. So that's has their blood pressure under the target level of where it should be. So that's only 1 in 4. So that's for the high blood pressure. Over 38 million Americans have diabetes. And there's an estimate that there's 90 plus million people that have pre-diabetes. I think we touched on this before. Pre-diabetes is like the ultimate warning flag. You get pre-diabetes, that's before you have to get, definitely on some medications of the nature. And it's also a place to where you can reverse it. So, but pre-diabetes 90 million plus people have pre-diabetes and most of those people do not know they have it. Okay. So, and then for our community, it gets even worse. Okay. African Americans develop high blood pressure earlier. It's nothing for me to get a person in my practice that has high blood pressure and you're like, hey, when did you find out? And they're like, they were teenagers, they were 20s. And a lot of times they get it and they don't really treat it at that level, right? So African Americans tend to develop high blood pressure earlier. We tend to have, more severe disease. So like I said, our blood pressure tends to be a little higher, sometimes a little more difficult to control. And we're, disproportionately affected by, we those end organ issues. So stroke, kidney failure, heart disease, and with diabetes, amputation. So like we have a higher rate of getting amputation for those that get diagnosed with diabetes. So African American adults, 40% more likely to have high blood pressure, 40%, 40% more likely to have high blood pressure. Nearly twice as likely to develop kidney failure related to diabetes and hypertension. So you got all those things that are going on at the same time. So these are all the numbers. These are all the statistics that are going on there. That's the background. But a lot of times people will say, they still say, I feel fine. I feel fine. I feel fine, doc. I don't even feel nothing. So that's one of the things we get. I feel fine. So, and that actually becomes a difficult thing in a practice that's busy because I know a lot of times people like, oh, the doctor, this, that, and the other. You know, if if you have a condition and you walk in and someone tells you, hey, you have high blood pressure, you have diabetes. And the first reaction is, well, I feel fine. I don't notice anything. I get this a lot with the kidney. I know it's a little bit off topic, but the kidneys. And people are like, well, I don't feel, my kidneys feel fine. I don't feel nothing. Well, this is a solid disease. You don't feel anything. A lot of these diseases, you don't feel anything until the end. And our goal, like I said, the goal of this show with WVOE, Pressure MD Academy is to teach you to learn to manage this stuff well ahead of time. You want to get this stuff well ahead of time. You don't want to wait until later. You want to get it in the beginning. It's kind of like a fire. You don't want to get the fire when it's burned half the house down. You want to get it when it's a little spark. And that's what we want to do is we want to teach people to get it before, you want to feel, you want to put out the fire in your house before you feel the warmth of the flames. Okay. You want to get it, you don't want to wait till you get the warmth of the flame. That's, you want to get it early on when it's just a spark somewhere. That's what you want to do. And so the same thing with these conditions. You don't want to wait until your kidneys have failed. You don't want to wait until your heart has failed. You don't want to wait until you've got a stroke, because that's might be the only feeling that you have of high blood pressure. Okay. So that's why we want to get this stuff this early. Okay. All right. So why are these conditions missed or ignored? Okay. So yet again, a lot of them symptom free. That's why we call them silent. That's why we call them killers. They're silent. Okay. High blood pressure, diabetes, both of these things can start out and you can have it for, months, years. and it could just kind of lay dormant. And then all of a sudden it gets a little bit worse. Okay. So high blood pressure doesn't cause pain. Diabetes can develop quietly for years before you know it. And most people associate having pain with having problems. Okay. And in these conditions, like I said, no, by the time you have pain, you've significantly damaged an organ. So you can't wait. It's like, driving, having a car and the oil engine lights on where you can't hear it. You don't hear nothing wrong with my car. My car driving fine. Well, and then your engine is blown. Okay. So that's why you do it. In addition to that, especially for the African American community. So if you're in an area and mama got diabetes, dad got diabetes, your neighbor got diabetes, and especially, a lot of times what happens is that we don't even use the word diabetes. Got a little sugar, a little sugar, my sugar a little high. You know, you kind of normalize it, right? It's kind of it just becomes normal. It's like, everybody got this. Well, why should I control this? Everybody got a little sugar, right? Everybody pressure a little high. And so this becomes normal. So if you're in an area where a lot of people have it, not just your relatives, but your neighbors, your friends, at some point in time, this becomes normal. And if no one's telling you how to treat it or prevent it, or if they're not listening to get it treated or prevented, then not only having it becomes normal, but not treating it also becomes normal. And so this gets normalized in the community. And at some point in time, it becomes part of the culture. If you got 3 or 4 generations of people that have had it, not controlled it, and suffered the consequences and did not change, even at the end, you got a culture where you don't even think it's abnormal to not take your meds, to not monitor your blood sugar, or better yet, like I was in a potluck, and the young lady said, yeah, my my monitor kept beeping, so I took it off. I'm like, what monitor? Well, my diabetes monitor. It it kept going off. What do you mean it kept going off? Yeah, it keeps beeping. It keeps beeping. Now, when I looked in her plate, she had 3 slices of pie. So I'm like, it's because of what you're eating. If that's your neighbor or your auntie, like I said, the young people around, and they say, oh, well, if my thing starts beeping, I'm just take it off. So this stuff becomes normalized in your culture, and you don't even think that being well is a normal state. You think being unwell is a normal state. So that can happen. That can happen inside the community. Okay, and do not underestimate that. Right. So yeah, so the stuff starts being normal. It doesn't feel dangerous anymore, and like so, there you're in an environment where all this stuff is happening. Okay. So, on top of that, you can add, mistrust, historical trauma. And I would say it's not just historical trauma, it's modern day trauma, right? A lot of African Americans don't feel heard in medical settings. They feel rushed or dismissed, or they've experienced bias or unequal treatment. And this can lead to delayed care, skip visits, or stopping medications. And that's one of the reasons why, this show, yet again, health facts, WVOE, PressureMD Academy, our goal is to get you into the health, American healthcare earlier when you got control. Because if you wait until you are sick, then you're at the mercy of whoever is there. But if you get it earlier, if you get in earlier, you can learn, who different people are. You can learn that they're different. Hey, I got one primary doc, I switched to another primary doc, and then I switched to another one. I didn't like the first one. I like the second one a little bit, and the third one I really love. So you start to learn that there are more than one. One doctor does not represent all the doctors. One NP does not represent all the NPs. One physician assistant does not represent all the physician assistants. One front desk clerk does not represent all of them. You have options. And so it's easier to understand that when you're well, so that if you go in for your checkup and things don't go right, and you go to another one and you can experience that. But unfortunately for us, like I said, a lot of times we'll get the one bad experience, and who do we tell? We tell everybody about the bad experience. We don't tell anybody about the good experience. And you got that going on. Then you also have real harms. I mean, it's like, we have there's documentation of the healthcare and healthcare providers, actively doing harm. I mean, like I said, I think the most uh, famous one is the Tuskegee experiment. And a lot of times, like people are like, well, you know, it's back then. Well, yeah, it wasn't. It's not. I mean, like so that implication of what happened there that reverberates throughout generations, and is an easy thing for people to point to for as it says some of the distrust. And then on top of that, we're going to add some more on top of that. The reason why people have mistrust and historical trauma, and that is one of the things is not feeling heard or feeling rushed. And one of the things I always like to tell people is that, there have been documentations that for a primary care clinician to function properly, they actually build in that that clinician, that physician is only supposed to spend, I think it was like 8 minutes per patient. Okay, that's the way that system was designed. That the physician is supposed to be in there no longer than 8 minutes and then get out. And that's one of the reasons why you come in there with five problems, they make you pick one, and then you got to come back. And so and literally, and as I'm kind of going through my own practice, you start learning about the billing and find out that yes, they won't pay. The insurance company won't pay for you to take care of five problems. They only pay you to take care of the one, and you have to bring the person back, which of course doesn't make any sense, but that's whatever. So that's what's going on. But like I said, all this stuff leads to mistrust, especially if you knew somebody that had a bad experience, or if you're not familiar with how this stuff works. So, or the other thing is this, and like I said, if you missed three, you had problems for 3 years, and then you walk in there, you got like 10 problems, and you want them all solved one time, but nope, you got to come back 10 different times to get each one of those problems sorted out. So all this stuff goes into it really exacerbates in a community where there's already mistrust, there's already, perceived mistreatment and things of nature going on. So all this stuff kind of adds to it really adds to the problem because if you don't go get the care or you skip the visits, you can't get the care that you need in order to get everything under control. Okay. And then also, you got the issue of medications being stopped. And why are they stopping the medication? Well, they don't trust it. You don't trust the doc. You don't trust the nurse. You don't trust who's going on there. Why? Because they did not have time to explain to you why you have this medication. Or like I said, maybe maybe you were trying to get something else taken care of. Maybe you came in because you stubbed your toe. They tell you got high blood pressure and to take these three medications, and you get home, you're like, wait a minute, you ain't even fixed my toe. So all this stuff goes on, and it's one it all that stuff contributes. Okay, so it's just the reality of what goes on there. And then we got poor explanations, not poor intelligence. Okay. So a lot of patients, there's the medical world, then there's, what I call people world or like the real folks, the patient world or whatever. And, people like to say, oh, people are, they're not adherent, they're non-compliant, they don't understand the whole nine yards. But a lot of times what it really is that, there's poor explanation, not poor intelligence or not low intelligence. It's poor explanations because, you know, a lot, patients, and again, I find this a lot. Patients are not necessarily unmotivated. They're just underinformed. They just don't know. They may not know what sometimes you just don't know what you just don't know. So, and that's where we're going to jump into a little bit about health literacy because if you don't know what you don't know that like I said, you walk in, stub your toe, they hand you three prescriptions, none of them are for the toe, and you're trying to figure out what the heck are these medications for. So I said, and if nobody sat down and told you what those meds are for, you're gonna put them to the side, right? And then go back and say you may tell them you didn't take them, or you may not. So all the things go into why people are not taking care of some of these conditions. Like I said, sometimes they got the condition you don't know. I've had people that that explained to me that they come to me for hypertension. So that's the labels on there, everything is there. I'm talking about hypertension. And I think during the conversation, I just happened to mention the word high blood pressure. And they got and the person was like, oh, wait. Yeah, I have high blood pressure. But I ain't know nothing about hypertension. And I'm like, wait a minute. Oh, and then you realize that the individual doesn't understand that hypertension and high blood pressure are the same thing. Okay. And that's on us. I mean, it's really on us. There's more than one word out there. And sometimes we don't understand that that person doesn't understand because we use the term so interchangeably all the time. That's just the clinician world, right? That's just the clinician's world. Like if you talk to the nurse, doctor, whoever it is, they just know this the two things are the same. But if you're someone that's not exposed to it, then that becomes a major barrier. And that brings us into health literacy. Okay. So health literacy is important because it helps you to understand what's going on with your health care or your medical care, right? Um, and when we say literacy, typically we mean reading. So if we say, oh, a person's literate or not literate, that term typically refers to a person's ability to read, right? Just regular reading. When it comes to health literacy, it's not just reading. It's not just your ability to read, because, like I said, you could be a lawyer, you could be a banker, and not have high literacy, because uh, health literacy is understanding what your numbers mean, understanding what certain terms mean, knowing what to do with instructions, being able to ask questions and feeling confident navigating healthcare in America. Okay. And this is a very different set of skills um, than just being regular literate. And it's impacted by those things we said before, by culture, it's been impacted by your personal history, whether or not you have mistrust, whether or not you have historical trauma. All that stuff goes into health literacy, and whether or not you have um, whether or not you've been exposed to certain terms, or that you have confidence, or that you feel comfortable asking questions. So all that stuff goes into health literacy. Okay. So, and then we got the other issue, and that is that general literacy so affects health literacy. I think a lot of people may have seen these stories where people are graduating from high school without, being functionally illiterate. Well, that's going to impact your health literacy. Okay. Like I said, so if a lawyer can have terms and stuff that they don't understand, or don't associate with issues that are going on inside of the medical care space. Well, if you can't read, if you graduate can't read, guess what? You're going to have a lot more trouble and require a lot more time whenever and it, when in terms of when you're in that healthcare space. Okay. Um, so general literacy affects health literacy. Okay. Health literacy affects outcomes. So your ability to understand, your ability to ask questions, your ability to say, hey, I took this pill and I got a rash, or I took this pill and I didn't feel right. And hey, do you have anything else? Because that may trigger, like I said, first of all, if they don't know that you had a bad response, you know, they don't know, we don't know to change your medication. So you gotta, that's part of your health literacy. Low health literacy leads to medication errors, missed appointments, poor disease control, higher hospitalization rates. Because if you don't know that you're supposed to take this med yet again, and your diabetes gets out of control, or maybe, you're supposed to take something for your heart failure, and you don't understand that you're supposed to, that's what that's for, then, like, guess what? You don't take it, or you don't tell nobody, then you wind up in the hospital. So you got stuff of that nature. So when it comes to your health, like I said, you get diagnosed with diabetes. You need to know you got to know what a hemoglobin A1C. If you have a diagnosis of diabetes, someone should have explained to you what a hemoglobin A1C means and how that impacts your diabetes. And the reason I'm emphasizing this is because I have seen people that have had diabetes for years and do not, and according to them, I was the first person to mention the A1C. Now, whether or not that's true or not, it may be just the fact that I took extra time to explain what the hemoglobin A1C means. Because in the medical world, a lot of times we'll just say, hey, your A1C is 9, your A1C is 7, or we say your A1C is good. Okay. Your A1C is good. And not explain to you that, oh, your A1C represents where your blood sugar has been over the last 3 months. Okay. And so if it's elevated, that means your blood sugar has been running high for the last 3 months. If it's where it's supposed to be, your blood sugar has been running good. So that stuff is what's going on there. So if no one explains that to you, you may not associate that with how well your blood sugar is controlled. You know, you know, if no one explains to you why your blood pressure goals have changed or where your blood pressure should be, maybe we start out at a certain blood pressure level, you have a medical event, and I may lower that blood pressure range, or maybe it was low and I had to, raise where I want your blood pressure to be. So we got to tell you what's going on with that. Maybe I need to explain what blood pressure is. Okay. Hey, there's a top number and a bottom number. The top number is when your heart squeezes. The bottom number is when your heart relaxes. Both of them are normal. The top one should be here. The bottom one should be there. And when you write down your blood pressure, write down both the numbers. Okay. Because I've had people come in and they just wrote one of the numbers. Oh, okay. And I understand at that point in time. And that's one of the reasons why I like to send people home with a blood pressure log. Write your numbers down and bring them back. Because when they write them down, bring them back, I can see what they're writing, and then I can explain to them what these numbers mean and why one's going up, one's coming down. Oh, and this is when see when you stop taking your med and went up, and then you start taking your med and went back down. Okay, now there's a connection in there. So it becomes a teaching moment. It becomes a teaching moment, right? So we got that. Then you have to explain to people what how food affects diet, blood sugar. A lot of people don't understand when they think diabetes, they think sugar like, the Dixie Crystal sugar, not understanding that slice of white bread is gonna when you eat it, it's gonna turn into sugar. And so they not here eating sandwiches, 3 times a day, with with jelly, and not understanding that stuff is turning into it. So that's why you need diabetes education. Okay. And then, stuff like kidneys, understanding why, that the kidneys are important and they can be affected by different things. So of course I had to throw a kidney in there, right? I'm a kidney doctor, right? So that's it. So, and so that sets people up for failure. If you don't address the health literacy piece, that really does set people up for failure so that they can't, it's hard to win when you don't know the game. Okay. If you don't know the game, you don't know the rules. It's just really tough, right? So, so that's another thing that contributes. So some of the things and then we got certain warning signs. So when we talk about symptoms, there are sometimes we do get warning signs, and those warning signs can the people can ignore. You know, and so even though they're silent, sometimes, hey, even a ninja makes noise, right? Even a ninja makes noise. It's like yeah. So even these silent diseases, a lot of times they will give you some warning before things really go bad. Okay, even if don't put oil in your engine, like I said, if it usually will give you a warning before it completely cuts off. So you got things like blood pressure will give you like frequent headaches. Sometimes you get dizziness, shortness of breath, chest pressure. But those, you don't get me wrong, you get those things, you really need to be going to see somebody immediately. Okay, you need to be going to ER or something. Diabetes, you can get warning signs like increased thirst or urination. You can get fatigue, blurred vision, hit wounds that don't heal well, tingling or numbing in the feet. Yet again, these are actually, don't get me wrong, they're warning signs, but by the time you've gotten these, you've already had some damage going on. But like I said, definitely that's not like just normal aging or like, oh, I'm just getting old or whatever. Yeah, no, you need to go see somebody and get this stuff taken care of. Okay. So that's what's going on as well. Okay. So, and, as kind of a wrap up here, we're going to just talk a little bit about consequences of ignoring silent killers. Well, you ignore a silent killer, guess what? You die, right? So, you're talking about increased risk of heart attacks, strokes, kidney failures, the possibility of dialysis, blindness, and this is one that a lot of people don't think about with diabetes. You can go blind. Okay. You can go blind quickly. You're supposed to get your eyes checked every year if you got a diagnosis of diabetes because you can go blind. I've seen, 40-year-old people, with blindness from diabetes. And that's just not, it just breaks my heart, right? It just breaks my heart because that's not something we want to see. Okay. So this kind of wraps up this first part of, the first part of this series. where we just kind of want to talk a little bit about these silent killers, kind of set the pace for the rest of the year. Just letting people know that this stuff is still out there. You still need to find out what it is. Still need to get it treated. And so as always, I'm gonna challenge you that if you do not have a primary care doc, that make sure you establish one. I got to change mine because I missed an appointment late last year, and the next time they could get me in is going to be the middle of this year. So I've got to find somebody that can see me a little bit quicker. That's got a little bit more opening, so that I can schedule, so that if I have to reschedule, it can't be 8 months. Okay, God, it just can't be 8 months. So yeah, so that's going on there. So outside of that, like I said, definitely go if you don't have a primary care doctor, go get your primary care doctor, get your labs checked, go ahead and get your physical scheduled. If you have questions, feel free to reach out to us. We'll answer anything that we can, or point if we need to point you in the right direction. So feel free to reach out to WVOE. You can reach out to PressureMD, www.PressureMD.com. Like I said, go to that website, send us a little message if you want to. You can also you can respond to this live stream. Type something there. We'll read it. We'll respond back to you, and try to help you out however we can. So go ahead and do that. And thank you for tuning in. Thank you for everyone that's listening on WVOE. Thank you for everyone that's tuning into the stream, this live stream, or if you're watching it, the recording. We appreciate you as well. And like I said, tune in with us next week. We're going to talk about the part two of this, where we're going to talk about things you can do. What you can do. How can you battle this? How we gonna fight? How we gonna fight this silent killer? We're gonna catch this killer. We're gonna throw a little right into him, maybe a left hook. So yeah, so we're gonna do that. So yeah, that's kind of wrapping up the day. And Miss Martha, any questions or concerns? Anything you want to say? Okay. All right. Well, thank you very much. Thank you for having me on the show. And like I said, we'll look forward to the show next week.